turning to the standoff between the government and doctors over medical reform. Having reaffirmed its intentions to push ahead with medical school quota expansion, the government is now sharing its plans for a special healthcare allocation from the national budget. Choi Soo-hyung has more.
Amidst the ongoing conflict regarding the government increasing the medical school enrollment quota, the Health Ministry said it will announce a special budget by the end of May.
To ensure concentrated and stable funding, we plan to operate a special account for essential medical services. The next 2 months will be the most important time for budget planning, with a budget request submitted to the Ministry of Economy and Finance by the end of May.
Meanwhile, the presidential office announced plans on Wednesday to increase healthcare spending to ensure that essential medical services are restored to their appropriate levels.
The Yoon Suk-yeol administration plans to place the healthcare sector on an equal footing with constitutional duties such as security and public safety. The government aims to make bold investments into medical services.
In the spending plan, the government announced it promised to take over the responsibility for the practical training of trainee doctors itself. The government will also allocate additional funding to regional healthcare and research and development into the expansion of essential medical services outside Seoul. Meanwhile, it is sticking to its regional medical school quota increased to 2,000 students beginning next year and has finalized allocations for each school. At the same time, the government continues to urge for dialogue with the Korean Medical Association. On Tuesday, pediatrician Im Hyun-taek was elected as the new leader of the KMA with 65% of the votes cast. He has voiced opposition to the government's plan and could push for an even larger-scale collective action. The exodus of medical school professors nationwide has continued, including almost 430 at Ulsan University and around 400 at Seoul National University. To minimize disruption to patient care, the government says it will deploy an additional 1,900 physician assistant nurses and 200 more public health doctors. Choi Soo-hyung, Arirang News.